So facial plastic surgery is, for the most part, a division of head and neck surgery, which is my original training is in ear, nose, and throat and head and neck surgery. I kind of say I operate from the clavicle to the brain. And this includes both the upper face, the eyebrows, the eyelids. Lower face and neck are kind of often considered a unit as well, which is corrected with sometimes just some liposculpture of the neck or a face neck lift, which there's slight variations of those as well. The nose is a interesting area because I often do surgery for it for functional reasons. People can't breathe through their nose, but also for cosmetic purposes, and sometimes combining the two. Otoplasty, which means ear pinning or ear reconstructive surgery, can be anything from kids who have Dumbo ears, which I'll show you some funny, or not funny, but interesting pictures of some of those. But even adults, some people are bothered by not being able to pull their hair back. And another thing that Chris mentioned that fillers can be used is in the earlobes. Many people also have elongated earlobes or earrings that have pulled through the earlobes, and that's another part of sort of ear reconstruction. And then, of course, there's the skin, and I really consider the skin to be the foundation of the face. Any sort of investment in taking good care of the skin makes all of these treatments, these options, these surgeries, which is a huge investment, that much safer, more effective, and more long-lasting. So I kind of think of addressing the skin of the face, be it with good skin care, with sunblock, with laser treatments, to be an insurance policy that you take out on an investment that you're making in your appearance and complexion. The way we like to initiate a discussion about facial rejuvenation or facial surgery in general is with a consultation visit. And we have a neat option or program that allows me to essentially give you a preview of what I feel I can achieve with a surgical procedure. So this is a woman. You might notice her hair is exactly the same in these two photos. And what I did is I gave her an idea of what we could achieve with surgery using the computer. Oftentimes the computer can do a pretty good job, but real life before and after photos I think really shows what we're able to achieve, and that's what the rest of these will be. So facial rejuvenation surgery really encompasses a lot of the things I just mentioned, from sculpting around the neck, which can often be a great option, but typically is best for younger individuals. A mini lift or a mini facelift is a great way for middle-aged and even some women who have aged very well, and we owe a lot of this to our parents, so we can be thankful or perhaps spiteful to them. The mini lift, it does involve some smaller incisions hidden around the ears. I'll give you some great examples of these. A little bit less downtime, quick recovery, even upon the order of 5 or 7 days. Focusing on the neck, there are a few different options. A traditional facelift is something that is still really a pretty amazing thing. I did one yesterday, and it can make a huge difference in the lower face and neck appearance. And then the brow is another area that we'll address, and I'll kind of talk about that later in regards to the eyes as well. So a lot of this first part is talking about some of the options for the lower face. This is a woman who was getting ready to be married, and she was feeling that she didn't look her best. So I combined some liposuction or liposculpture under the chin, as well as what's called an endoscopic brow lift, which I'll talk about a little bit later. You can see how it opened up her eyes, but certainly you can see, and perhaps a little bit easier here, how that reshaped her neck and just, again, moved a little bit of the volume from the lower part of the face to the upper part of the face. And some of what we do seems to be a little bit of magic or optical illusions, but in actual fact, they are real changes. Moving on to kind of the next step along the progression would be a mini lift or a mini facelift. And this was another little combination, and that's an important point, is that we're able to combine a lot of these into one procedure or one operation, and sometimes we stage them and do one thing first and then move along to another. This was a woman who was showing some changes along the jawline and neck. We did a mini facelift, and hopefully you can see it with the color on the screen, but also did some fractional laser resurfacing to kind of just improve her skin tone. And she had seen a lot of sunshine. You can see some of the freckles and whatnot on the left picture, certainly much improved on the right. Here's that same woman looking from the other side, and you can see especially along her neck and jawline. I should mention all of these patients did give permission for me to use their pictures, so I would certainly never use someone's picture without their permission. Again, another example of combining some procedures, altering the lower face and neck, and also doing a little bit of liposuction. And actually, I also reduced her earlobes. She had worn heavy earrings for many years and was bothered by some of the enlargement of the earlobes. So you can see how that just made her ears appear a little more in proportion with the rest of her face and neck. Another nice combination, and I'll get to this extensively, but upper eyelid surgery, I think, really is one of the most dramatic changes. And the reason for that is we look each other in the eyes. So I combined that in this woman with a lower face and neck lift, as well as a little bit of laser resurfacing at the same time. Certainly, the lower face and neck can be a pretty dramatic change in the overall appearance of the face, as well as specific areas. So this was a woman who really was unhappy with her neck and some of the wrinkles in the corners of the mouth and face. I really try to keep a natural appearance, and I think this is a good example of that. And it was interesting, this woman even said, I don't really mind my folds, my smile lines. After the fact, she came back and we did do a little filler into those areas, so she may have minded them just a bit. In some patients, a chin implant can be a really nice option to balance out the face in terms of its proportions. This was a woman who had some extra skin in the neck, a little bit of changes around the jawline, and she also had a sort of recessive chin. So adding a chin implant really sort of was the nice balance to correct everything in that region. Here she is from the other side. I think that even shows it better. And again, sometimes a traditional facelift, able to really dramatically change the overall appearance of the lower face. And going back again to what Chris talked about in terms of the triangle, if you look not just at her lower face and neck, which of course your eye is drawn to here, but look at the volume that's been added to her cheek. Because essentially the aging process is a lot of things moving south. Gravity keeps us on this earth, but it also does some other things we don't necessarily like. So, moving on, a brow lift in the past was quite a dramatic procedure involving pretty much an incision that was made from ear to ear right across the top of the head. And one of the great progressions and advancements that we've seen in facial plastic surgery is being able to do this now, and I'd say I do probably 80 to 90% of these this way, is with an endoscope through a series of tiny incisions, similar to the way they now take gallbladders out, and they used to take them out through a very large incision in the belly. I'm able to use these tiny little fixators. They're kind of like carpet tacks, and they're dissolvable, and they kind of hold the brow in its new position. And you can see what a big difference that can make in terms of opening up the eyes. I really talk about the brows as being the frame for the eyes. It's kind of the picture frame that they sit in. And if that picture frame is really small, you can't really see the picture even if you have a beautiful picture. So lifting up the eyebrows is a way to essentially open up the eyes and change that picture frame in and of itself. This was a woman I also did a mini facelift really to address the neck. She had said many times that she had the same neck as the rest of her family, which pretty much went from her chin to her chest. And she really wanted to have a nice little angle there, and I think we were able to achieve that for her. Another woman who really just kind of felt a heaviness around the brow, and I think hopefully you can see some of the lines in the eyebrow on the picture on the left. Now, Botox or one of the other neuromodulators can really help that, and it did help that, but unfortunately relaxing the muscles in the eyebrow also causes the eyebrows to come down. So she said, I really want to have a smooth forehead, but I have to hold my eyebrows up all the time or I can't really see and I don't like the way I look. So a brow lift allowed us to both relax those eyebrows so she can just have a nice natural expression all the time. And as she put it, I don't look so angry. Eyelid surgery, again, is one of my favorite things to do and probably one of the things I do the most. There are a whole different spectrum of procedures that I do on the eyelids, both functional in terms of for patients who are having issues with vision or tearing, crying eyes, but a lot of them are also for cosmetic purposes. And these are some of the things that I can address for cosmetic purposes. I'd start out with this one because I think it really shows the dramatic difference that can be made in a gentleman. And things are a little bit different for men and women. But I think you can see that took about 15 or so years off, at least that's what he felt afterwards. And a lot of people do say after this type of an operation that the world gets a little brighter. Again, really trying to achieve very natural results is my goal here. In the past, people were very aggressive in terms of how much skin was removed and other fatty tissues, and I've really found that refining this to really just deal with the issue in each individual patient is the best goal. So I'll kind of move through some of these. Again, please stop me if there's one that kind of grabs your attention. But really can make a huge difference in terms of how people appear and how they portray themselves to the world. When we deal with the lower eyelids, that's an area that I think also can really give away our age perhaps a little sooner than we'd like. Here's a gentleman, and I do treat men. I know we have an audience primarily of women. This was a gentleman who really just on one side had some swelling or poochiness or a little fat deposit under the eye. And after addressing that and removing it, he's a lot more symmetry. And you can really see that from this direction as well. And in fact, it also helps with some of the dark circles under the eyes when they are due to shadowing from that little fat deposit. Another example of treating both the upper and lower eyelid, you can see, especially in that angled view, the smoothing of the lower eyelid area. It can sometimes be a pretty dramatic effect, and I think this one perhaps shows it the best in terms of really taking years off. And it's interesting, I have had a number of patients who have treated their eyelids and they come back and say, a lot of my friends asked me if I had a facelift. And I think it just shows how much attention comes to the eyes. Occasionally I will adjust the brows through a slightly different method, which I used in this gentleman, through some incisions that are actually hidden right around the eyebrows, and you won't be able to see them, but they're there.